We're going to be performing the head, neck, and lymph node exam. First, I'm going to inspect and look at the patient's face. I'm going to feel the head and the hair. I'm feeling for any lumps, any tenderness, any open areas on her head. Everything feels normal. Next, I'm going to palpate the frontal and maxillary sinuses. So kind of right here above her eyebrows. You're going to feel for any tenderness, any swelling in those. And then right here above her cheekbones, I'm going to put my hands right here and feel her sinuses. Do you feel any pressure or pain when I'm touching you? No. Okay. Next, I'm going to go behind the patient and I'm going to feel their thyroid gland. Just like that. I'm going to put both hands kind of around her neck right here. I'm pushing with my right hand and feeling with my left hand. And then I'll do the same thing. Can you swallow for me? So you shouldn't feel any like small little nodules or lumps on the thyroid, and no pain or tenderness when I'm touching the patient. Does that feel okay?
Mm-hmm.
Okay. All right. Now I'm going to assess the cervical lymph nodes. There's 10 of these. The first one is the preauricular, and it's in front of the ears. The second is the postauricular, and that's behind the ears, or the posterior auricular. And then the occipital, if you'll lean your head forward, is in the back of the head. So I'm just feeling all the lymph nodes for swelling, tenderness, pain. The next one is the submental, which is right underneath her jaw here. Then we have the submandibular, which is sort of in the same area. So I'm feeling that. We have the jugulo-gastric lymph nodes. Then we have the superficial cervical, which is just the neck lymph nodes. And then there's the deep cervical, which is just a little bit deeper. The posterior is towards the back of the neck, posterior cervical lymph nodes. And then lastly, we have the supraclavicular lymph nodes. And I don't feel anything abnormal. Does that everything feel okay?
Mm-hmm.
Okay. The last part of the exam is where I'm going to be looking at her ears, and if I had an otoscope, I would pull her pinna or her ear up and back. I would stand with my hand kind of against her face when I'm looking, so that way if she moved, it wouldn't puncture the eardrum. So I'd look up and back, and I'll look through each side of her ears. I would look at just look at the inside for swelling, redness, any drainage, so all that. And then the last part, if I had an ophthalmoscope, I would look into her eyes. So when you use the ophthalmoscope, you make sure if I'm standing on her left side, I look through with my left eye to look into each eye. If I'm standing on her right, I look through my right eye. So that's how, but I don't have one of those. And that is all for this exam.